Hello! Today we're going to be talking about a STEMI, otherwise known as an ST elevated myocardial infarction. So let's talk about what is a STEMI. Like I said, STEMI stands for ST elevated myocardial infarction. This is caused by low blood supply and oxygen to the heart's tissues, which is usually due to a blockage in the arteries that supply blood to the heart. And an artery is a blood vessel, and so there are coronary arteries which supply blood to the heart. A STEMI is diagnosed by an EKG, otherwise known as an electrocardiogram, which is a strip that provides a picture of the heart and how it's functioning. There is an example of an EKG down here at the bottom of the page. And in this we can see an example of what a STEMI looks like. So on an EKG there are different sections of the rhythm. There's the P wave. There is the QRS complex, because there's Q, R, S, and then there would be a T wave right here. But we can see that instead of this line coming down and then forming the T wave, it is elevated. And so that right there is our ST elevation. And to define a STEMI, or the ST elevated myocardial infarction, otherwise known as a heart attack, there is an approximately 1 to 2 millimeter elevation seen on the EKG in what are called two contiguous leads. And this just means that these leads anatomically on the body are next to one another, and they give us a picture or allow us to view the same area of the heart. So how is a STEMI treated? Well, it can be treated through various methods. For example, there's something called PCI, or what is known as percutaneous coronary intervention. And this is used for what's called balloon angioplasty and stent placement, which you can see over in the corner here in these pictures. So the balloon angioplasty is used to widen the blood vessel that has the blockage in it, which you can see right here. So that is our blockage, this plaque. And then this catheter goes into the artery and it will widen the blood vessel, so you can see right here, using this balloon. From there, you place what's called a stent. This is your stent right here, which is a device that helps to keep that blood vessel open so that it can still continue to bring oxygen and blood to the heart tissues. You can also be placed on something called anticoagulant therapy. These are basically just blood thinners. And these are medications that thin the blood, and this is to help prevent a clot from forming, which can close off that artery that supplies blood to the heart, which is what causes that tissue damage when those cells don't get oxygen. Or in other cases, you can have what's called a CABG, otherwise known as a coronary artery bypass graft surgery, which most people are familiar with bypass surgery, cardiac bypass. And this is for patients in more severe forms who cannot be treated with the previous methods, or were treated and those methods failed, or are like medically unstable patients. And some modifiable risk factors for a STEMI include diet and exercise. For diet, you want to lower cholesterol and stick to a heart-healthy diet, and we'll discuss that later in the next slide. Exercise is recommended. Moderate intensity exercise, roughly 5 to 7 days a week, for about 30 minutes a day. An example would be a brisk walk, 30 minutes a day. Muscle strengthening activities are also recommended at least 2 times a week. As well as another risk factor would be taking all prescribed medications as directed by your doctor. Some diet modifications. So these include smaller portion sizes increasing fruit and vegetable uptake, so eating more fruits and veggies every day. Lowering sodium intake. This can include, so some ways that you can do this would be to avoid or limit salting food and instead try and season foods with spices such as cumin, turmeric, garlic. Limit foods such as canned meats, deli meats, canned soups. Fast food is high in sodium or salt. Sauces, so like barbecue sauce, honey mustard, ranch, stuff like that. Those are high in salt as well, so you'll want to try and avoid those. You can increase whole grains. These are foods such as whole wheat flour, oatmeal, steel cut or regular, whole grain pasta, whole grain bread, high fiber pasta, brown rice, barley, buckwheat. You'll want to avoid and limit foods then such as white bread, muffins, egg noodles, cakes, pies, buttered popcorn, stuff like that. Cornbread is another example. Biscuits. You can limit alcohol intake since that increases calories. Plan ahead for meals and figure out calorie intake. Looking ahead at what you're eating ahead of time can help to avoid eating foods in a pinch that might not necessarily fit within these guidelines. Limiting saturated fats. The recommendation is no more than 11 to 13 grams of saturated fat a day, and to avoid trans fat. And the way to check those would be to read food labels and add those up every day. These recommendations are based on a 2,000 calorie diet. So some examples would be to increase foods such as nuts, seeds, olive oil, canola oil, avocados, and instead avoid or limit foods such as butter, gravy, lard, things like that. You can also increase low-fat proteins. So some examples would be foods such as salmon, eggs, low-fat dairy products such as poultry, or lean ground meats. And avoid or limit foods such as, I know this is a big one, bacon, hot dogs, organ meats like liver, or full-fat dairy. Some references, and that is it. I hope that was helpful for you.